so Invisalign's really good at treating mild to moderate crowding, really good at fixing up the anterior teeth, so the teeth towards the front of the mouth. With many patients that want to go through orthodontic treatment, it's those front teeth that they really want fixed up, and that's where Invisalign is really good. Some people have really mild crowding, but it's still something that they want to improve, want to fix up, and Invisalign can be a really quick, effective way to fix that up. It's been around for a number of years, but it's constantly evolving, constantly changing. There's lots of research involved with it, so they're always coming up with new ways to move teeth, better ways, quicker ways to move teeth, and can see more patients and reduce the treatment time as well. The big difference between Invisalign and braces is that Invisalign looks a lot better. It's also a lot more comfortable as well. So instead of having the metal brackets that are stuck to the teeth, you get some custom-made trays that are made specifically for your mouth, and they move the teeth exactly where we want them to go, and it's just a lot more comfortable process whilst you're going through the treatment. So you can take them in and out. You do need to wear them though, so we recommend wearing them for between 20 to 22 hours a day, so you're wearing them all the time. Take them out when you're eating, take them out when you're cleaning your teeth as well. Otherwise you want to wear them all the time. If you don't wear them, they don't work, but it's a lot more comfortable because you can remove them, you can clean your teeth a lot better, and it makes your oral hygiene a lot better during the treatment. It's different for every case depending on your level of crowding that you have, but in some cases it can be fixed up in as little as 14 weeks. Other cases can take 12 months to 18 months, sometimes a little bit longer. It just depends on where you're starting and where you want to end up. There are cases where braces would be better than Invisalign. Both have their pros and cons in terms of what they can do with treatment. What we'd want to do is have a look at the teeth, look at where you're starting, look at where you want to end up, and go through the pros and cons of each one and work out which one is better for you. So we can look at either Invisalign in certain cases, we can look at braces in other cases, depending on where you want to go. In terms of the overall cost, they're very similar. Invisalign is very similar to a full course of orthodontics, so not too much difference. Yeah, it does depend on how long you're going to be in the Invisalign trays for. The shorter the amount of time, often it can be a little bit cheaper. It just depends on where you're starting. Once you've had any orthodontic treatment, whether it's Invisalign, braces, sometimes even plates, you want to be keeping the teeth in the position that they're ending up in. So that's really important, otherwise the teeth will relapse. We usually try and put a wire on the teeth, behind the teeth so you can't see it. Sometimes trays are needed as well, or little plates that you can wear at night to help keep them in that position, because you go through a lot of time and effort to get the teeth looking really good. We want them to stay where they are. So the wire that's stuck to the teeth, that's permanently stuck there, forever basically. With a plate, you want to be wearing that at night time, so every night, and yeah, continue to wear that. We always aim to get the wires on because it's a lot more comfortable, you get used to it really quickly, and you don't have to think about it, you're not going to lose it, but sometimes in some cases we need to use a plate. So it's really common to have braces when you're younger, but it's more and more common these days to have it when you're a little bit older, because there might be an issue that's been bugging you your whole life. Didn't really notice it too much when you were younger, but now that you're a bit older, you sort of see that and you think, I'd like to really get that fixed. There's no problem with going through Invisalign or braces when you're older, and it can be a really good way to get it looking the way you've always wanted it to look. People are worried about the discomfort associated with orthodontics, so whether it's braces or Invisalign. Invisalign is a lot more comfortable than braces during the treatment, and often patients say, you know, I feel hardly any pain at all. Invisalign's a really good way to go if they're concerned about that. That discomfort thing, that's the main concern that people have. And I guess the other thing that people want to know is, can my teeth be straightened? And that's where we need to have a look at the teeth and work out what is the best way to treat them. And there are always options, always solutions that we can look at.